as Alia kindly said, I'm a foundation doctor at Basildon Hospital. I'm in my second year at the moment. And I'm just going to take you through a little bit about the foundation programme application and what it is and what the life is like. So to put it into context, following on from Kabir's brilliant talk about medical school, your next 2 years once you graduate as a doctor will be in foundation training. And it's sort of an interim between finishing medical school and applying for the specialty that you want to do. And it's normally 2 years long, and you'll do 6 jobs that are around 4 months each within that time. And you'll do a variety of different things. So you'll do some medicine, some surgery, you might do a bit of GP or emergency medicine, orthopedics. And it's to kind of give you an introduction into what being a doctor in various different specialties is like, experiencing lots of different patients and learning lots of skills. So it prepares you really well for being a doctor going forward, and also will give you an idea of a specialty that you might want to pursue as a career as well. So personally, I've done medicine. I did an 8-month surgical job because of COVID. I'm currently on orthopedics, and I've got emergency medicine next. And I want to do orthopedic surgery going forward. So it was really important to me when I applied that I had surgical jobs in my rotations. So when you're looking at what jobs you want to apply for, it's quite a good idea to try and select things that have jobs that you're interested in. And also, if there's things you really know you don't want to do, then to try and avoid them if you can. It's not always possible, but try and limit what you don't want to do. And obviously, nearer the time at the end of your medical school journey, you'll go through the application process in more detail. But some important things to think about earlier on in your medical school training are, as Kabir said, when you're applying for your job, you are ranked in the country with the rest of the cohort graduating that year from all of the other universities. And they look at a couple of things. So at the moment, you sit a test called the situational judgment test, which looks at how you manage in certain scenarios. And they also look at how well you ranked in your medical school. So each year when you sit your exams, you'll be ranked with the rest of your cohort. And obviously, the better you do, the better score you have, and the more options you have for jobs that you want to do as a foundation doctor. So for example, if you want to study in London, you need to score pretty high and come fairly near the top of your year. So it's worth really pushing hard for those medical school exams if you know that you want to go somewhere that's quite competitive, just to give yourself the best chance. And something else I wish I'd known a little bit more about when I was applying is the academic foundation programme. So this is really useful for people who are really interested in teaching and academia or research. And if it's something that you think you might be keen on, when you're in medical school, you can get involved in teaching or do some projects with consultants or do some research, so that when you apply, if you want an academic job, you've got a bit of experience behind you, and you've also got something you can talk about at the interview. So I wish I'd known a little bit more about that, because I probably would have done an academic job if I had known sooner. And it's a national application process, so you apply across the UK, and first of all, you select which area of the country you'd like to work. So I personally chose Essex, Bedfordshire and Hertfordshire. And then you get selected for the deanery based on how well you've scored. And then you get to select jobs within that area. So I selected Basildon as I was there as a student and really enjoyed it. And I also selected to do surgery, orthopedics and emergency medicine as part of my 6 jobs. Obviously, it will depend on where you want to go. It's worth thinking about if you want to try somewhere new or be near family or friends, but it's an exciting opportunity to go somewhere you haven't been before as well. And a little bit about the day in the life. So as I say, I'm currently on my orthopedic job at the moment. So some days I'm on the wards, and a big part of your ward days is being basically an administrator for the patients on that ward and making sure you look after them and give them the best care. So you start your day with a ward round, and you'll have consultants and registrars come and look at the patients that are on the ward under their care. And it's your job to make sure that the notes are ready, that all of the information is there, and that you guide them on the ward round to see all of the patients and don't miss anybody. And actually, you might feel that your role is sort of a little bit low down, but actually you're a really important person in making sure that everybody's seen and all the questions are answered as you go around. From the ward round, you generate lots of jobs. So it might be that you need to order some scans, book requests, speak to other specialties, do some bloods or do investigations. And generally, again, it's quite administrative, but actually it's really important because it really does help keep the patients well looked after. And you also can flag up any issues or any sort of unusual results that you get to make sure that those are looked into. You still get teaching as a foundation doctor, so we get teaching sort of once to twice a week at the moment, and it will be on various different things. It might be specialty based or it might be more generic, and it makes up part of your portfolio and it's part of our curriculum to go to teaching. It's quite a nice opportunity to get off of the ward and do something different for an hour or so. And you also get to look after the unwell patients on your ward. So sometimes people become unwell unexpectedly. And as a foundation doctor, you're going to be the first person that sees them. You can assess them, you can order investigations, and you can start the management for them as well. So you can help make these patients better. And if you feel that you need a little bit more help, then there's always someone more senior there, a registrar or a consultant that will come and help you if you need them. And then always at the end of the day, just get yourself prepared, ready for the next day. Make sure, again, the notes are ready, all the results are written down. So it just makes your morning a lot nicer and easier going forward. The more exciting days are the on-call days. So this is when you're seeing acutely unwell patients. So as I've just finished a night shift, hence the dishevelled hair, but you carry the bleep and you get calls from A&E about patients that have come in. So I saw patients last night that had fallen and had fractures or had hurt themselves. And you go and take them and ask about what's happened to them and take their history. You order all the relevant investigations that they may need. And for patients that needed it, I got them ready for theatre. I spoke to the theatre team and the consultants, and now they get to go to theatre during the day. So it's a really nice way of seeing these patients for the first time and making sure that they get the immediate care that they need. As a foundation doctor as well, sometimes you cover the wards at night time or on weekends. And again, you are covering lots of patients, but you go to see those that have become acutely unwell, and you'll be the first person that again sees them, understands what's going on. It takes any investigations, you come up with your own management plans, and then you escalate it to a senior just to make sure that everything is done and that you've got the help that you need as well. And it's a really nice position to be in. You feel very independent, you get to really feel like a doctor, like you're making a difference, and it's quite an exciting time to learn lots of new things as well. And then at the end of the day, you hand over to the relevant team. So if you're finishing nights, to the morning team, and if you're in the day, you hand over to the night team, just to make sure that all the patients are well looked after, nobody gets missed. And it's also a nice opportunity if you've got any questions that you can ask your registrars about, and they can do some teaching for you as well. And some opportunities I've had during foundation training, I didn't really think I would, but I have. You get to come up with lots of new ideas. So when you're seeing patients for the first time, you quite often get to come up with what you think is going on with them. You get to think about how you would manage them. You get to start medications and treatment. And that can be really nice when you see that you've made an improvement for that patient and help make them better. You're also the person that works on the wards almost all the time. So if you think something can be improved, whether it be improved for your colleagues or improved for patients, you can make those suggestions and you can make a difference to how practice is carried out on the ward. And that's a really nice thing to see going forward. You learn lots of new skills. So quite often at medical school, you'll learn how to do bloods and cannulas and various different things. And you leave medical school not that confident with them because you haven't done too many. But within the first few weeks of being a doctor, you will have done so many, you'll feel very confident. You won't even think about them anymore. And it's a really nice change to see in yourself how confident you get even within the first few weeks of training. And also, if you're interested in certain specialties, so medicine, you have gastroenterology or respiratory, where you get to do lots of drains, you get to learn how to do those. I personally, as I say, want to do surgery, so I quite often go to theatre and learn skills there. But you can sort of tailor it to what you're interested in. You make lots of new friends. It's a really lovely time to meet people who are like yourself in a similar boat. In our year, we're really close as a cohort. Pre-COVID, we used to do a lot of things together. We had a ball, we used to go for dinners and nights out and things like that. And we still make an effort to spend time together at work. We still have coffees and lunches. And where, after COVID, I'm sure we'll go back to having our dinners and things as well. But it's nice to make all these lovely new friends and really support one another in what can be otherwise a stressful time when you're starting out. You can do lots of teaching and research. So personally, I'm really interested in medical education and simulation. So this year I've got to do lots of teaching for medical students and foundation doctors. And it's been really useful for my portfolio. It's been really useful actually making me more confident teaching other people. And I've really enjoyed doing that. Also done a bit of research and had some papers published, which has been exciting, which is useful for a surgical application if you want to do one. And you get to go to lots of exciting conferences and events. So if you do any work, any research or case reports, you can submit them to conferences, even as a medical student as well. There's lots of great medical student conferences now. And you get to go to all exciting places over the country, and after COVID, hopefully elsewhere in the world as well, and present your work and talk to people that are also interested in the similar things to you. And as I say, you get to have career opportunities. So I get to go to theatre a lot if I want to. I try and make sure I do that when I have spare time. It might be that you want to do a medical job, so you go to clinic or to see skills on the ward. Again, if you're in GP, you might do home visits and things like that. So it's a really exciting time to kind of tailor your learning to what you're interested in and try and get the most out of your free time and start working towards your specialty application. So in sort of summary, foundation training can be a little bit scary when you start out. You start out as a new doctor and it's all fairly unknown, but you gain confidence so quickly. Within a month, you'll look back on yourself and you'll realise just how far you've come. 6 months, a year later, you'll be so surprised by how much you've learned. And it's a really exciting time. It can be daunting, it can be stressful, but there are always people to support you. Chat to your friends, your family and your senior team, and they will always be there to help. So do make the most of them. And yeah, enjoy. It's a really exciting opportunity, and you finally get to be a doctor after 6 years and you get paid. So that's a really nice change as well. So thank you ever so much for listening. And if anyone's got any questions, I'm happy to answer them if we've got time, or I can have a look in the chat and go through things there.